Okay, I'd like to talk about a certain area of the face that you want to avoid when you're doing fillers. Okay, some people call this the dangerous triangle of the face, and it's pretty simple to avoid, and it's important to be aware of. Okay, and what this area, or where this area is, if you draw a horizontal line from the base of your nose laterally. Okay, so just kind of, imaginary line from the base of your nose and go laterally, and that triangle that's on the side of your nose, you want to avoid doing, you don't want to do fillers there at all. You want to completely avoid that area for several reasons. One, the aesthetic result is not going to be good, all right, because you're going to puff out that area. You're even going to potentially cause a flaring out of the nostrils. So cosmetically, you don't want to do that area, but for medical reasons, you want to avoid that because of the potential for vascular necrosis and ulceration, and it happens. You can look at pictures in the, in your textbook. It does exist. Okay, so again, it's this area right in the corner of your nose, but it actually goes down from the base of your nose. There's a triangle that's formed when you draw an imaginary line from the base of your nose across, and that whole area, you need to completely avoid that with your needle and with your filler product. So understand that when you're injecting these products, whatever product, let's say Juvederm Ultra, Ultra Plus, or whatever, you've got your syringe, you've got a 30 gauge needle. Usually you want to use a 30 gauge half-inch needle. With some of the other products, like let's say Juvederm Ultra Plus or Radius, you're going to use a thicker needle. You're going to use a 27 gauge needle. So whichever it is, 30 or 27 gauge needle, I said that you want to avoid this area. So mark it in your head. You could make a mark there as well, but you want to start your injection, trying to find on myself where that area would be. You want to start your injection lower. You advance the syringe and the needle forward. You want to make sure that the tip of your needle stops well before that dangerous triangle that I just mentioned, and then you want to depress your syringe, and you want to lay down a thread of product as you're pulling out. So you're pulling out like this, and then you lay that thread down, and the whole time you've stayed away from that dangerous triangle of the face. Okay, it's the same thing obviously on this side. So wherever it is, it's right about here. You want to advance your needle and your I almost said needle and thread. You want to advance your needle and your syringe, and you want to stop right before that area, and then you want to pull out right before you're doing that. So it's kind of important. So that's definitely a board question. Dangerous triangle of the face, avoid that with fillers.